Hello and welcome to this very special online event where we've got a wonderful panel and they are all experts and they're going to take your questions on COVID-19, kids and school. My name's Jonathan Karapetis. I'm the Executive Director of the Telethon Kids Institute. I'm also a paediatric infectious diseases physician. And let me begin by acknowledging that we are on the land of the Whadjuk people of the Noongar Nation, and I'd like to acknowledge their elders past and present. Joined tonight by a fabulous panel, and let me introduce them. Smith, welcome to you.
Thank you.
Neil's a former primary school principal and is the president of the WA Primary Principals Association. Dr. Monique Robinson, to my right. Monique's a clinical child psychologist and a youth mental health researcher at Telethon Kids. Hi, Monique.
Hi.
And Associate Professor Asha Bowen, she's Program Head of the Wesfarmers Centre for Vaccines and Infectious Diseases at Telethon Kids Institute and also in charge of Paediatric Infectious Diseases at Perth Children's Hospital. Welcome, Asha.
Thanks.
So we're going to keep things moving very quickly for you this evening because we know that there's lots of questions you're going to want to ask. Get straight into it. Let me just point out that on your screens to the right you'll have a sidebar with a chat function. So please upload your questions right now and throughout the course of the evening, and we'll try and get to as many of them as we can. And we've got a few that we've already got as to kick us off, and I'll get stuck into them straight away. So Asha, First question to you. How long could a child be contagious with COVID before symptoms appear?
So we usually think that it's between 1 and 2 days. So that's why we have the rules. You look back about 2 days from someone who's now tested positive to see who they've been in contact with over the last few days. So mostly you won't be all that infectious if you haven't developed symptoms yet, but we do know there's that short window that we need to pay attention to.
Great. So Neil, a lot of people are asking this. What advice are schools giving to parents about monitoring symptoms?
So schools are asking parents to use a common sense approach, monitor symptoms at home to see whether students are displaying any symptoms, be that sniffles, flu, cough, and to make the school aware if that is the case.
And what's the advice to parents if the kids do have a sniffle and they're otherwise not so bad? Are they allowed to go to school?
Look, we know that generally children come to school with a range of little sniffles or bugs or whatever it might be. We're being overcautious. Given the current situation, we would be asking parents to also be cautious. We don't want situations in schools where teachers who are already concerned and worried about 20, 30 students in their class continually having to monitor one child or two children, and are they sniffing and have they sniffed again, and now they're sneezing and then they're calling the office and the office is calling home, and then so to err on the side of caution and use some common sense in collaboration with your school is probably the best bet, and to keep children at home.
And do you think it would make any difference if a parent said, oh, I've done a rat test on little Johnny and Johnny's rat test negative, so I can send him? What would you say to that?
There are rules around having a rat test if students are deemed close contact, but they do need to be asymptomatic. So again, where they're showing signs of sniffles, coughs, even with a negative rat, we'd encourage them to stay at home because the symptoms are still there.
And Asha, do you think that this is giving us lessons about how we do this in general? Because I think the average parent probably tends to, in the pre-COVID era, send their kid to school even if they've got a bit of a runny nose and a cough.
I definitely think it's something that we need to pay even more attention to, because when kids get together, they can share their germs and they can share their illnesses. And so what we're doing is protecting all of the kids by asking families to monitor your children closely for signs of a flu-like illness, a fever, a cough, a runny nose, and keep them home if they have symptoms.
And I think the critical point here is that if you've got a virus, it doesn't have to be COVID for that to be transmitted to others. And we're talking about not just the inconvenience for you if you've got to stay at home with your child because they're sick. If you send them to school, there's a whole lot of other kids who are potentially going to be affected, and staff. And I think that's a message that we've learned out of this pandemic, that we've been far too lax at saying, off you go, doesn't matter if you've got a bit of a cold or a runny nose. Okay, Asha, a few questions for you. First one's about the kids under 5, where we know that they can't be vaccinated. We also know that there's masks are a problem. So what can we do to protect those young kids?
That's a great question, and I guess there will be a vaccine available for this age group, but we just don't know when. So I think it's important to be aware that that's coming. Until then, I think there are a lot of things that we can do. And something that I've observed that they do in daycares is really teach kids well how to catch their coughs in the crook of their elbow, as well as wash hands. And those are two things that we can be doing with the youngest of children to help them learn what we call respiratory etiquette. And they're probably better at it than almost every adult that I do know. The other things that we can do, I think, for this age group is making sure that we're keeping other children home from daycare or places where they're mixing if they've got symptoms. That obviously helps everyone stay healthy. And the routine child vaccinations, whilst they might not be the ones that are going to protect from COVID, the flu vaccine season is about to start, and we do recommend flu vaccine for the children under 5 from 6 months to 5-year-old for that particular age group who can't access the COVID vaccine as yet. So there are many other things that we should be doing and can be doing to help protect them both from COVID as well as from other infections.
Lots of things for them, but what about for the teachers? So the teachers of these very young children, it's pretty hard to teach kindy with a mask on. What are the things we can do to protect the teachers?
So I think once again for teachers in this age group, vaccination has been a key part of it, and I know that teachers have all been vaccinated, so that's one of the important strategies. The next thing I think is for teachers who are teaching the youngest age group to model that great hand hygiene, as we call it, washing hands or cleaning them with alcohol gels regularly, models that behaviour to the children, but also is protective for the teacher in that particular situation. And I think that where possible, mask use would be recommended, but we do understand that trying to communicate effectively to children in those very young years is tricky with a mask on, where they can't actually read your facial expression. So most of the time it's going to be using all of the other strategies such as vaccination and hand washing to protect themselves.
And Neil, are you finding that the teachers of those really young children are they more concerned, less concerned? Are they managing to do these other things like keeping the classrooms ventilated? Are those sorts of things working okay for those teachers?
They are. I think early on there was that natural concern and that uncertainty. I think as time has gone by and we're getting much better at following the protocols, at keeping areas clean. Certainly we've got department rules now at the education department where we are keeping air conditioners on, flow of breeze through the classrooms, and teachers also just using some common sense strategies such as taking children outside more. In those younger years, it's ideal to go outside and do lessons there, whether they're play-based lessons, whether they do a quick stint outside, come back in. Lots of classes are doing that extra stint of crunch and sip in their classrooms. So quickly unmask, have a quick bite to eat, have a quick drink, mask back up. So just giving children those breaks makes the day a little bit more normal for them, but also teachers are able to take that break as well outside. And the other thing to add to that is teachers, as caseloads have increased, rules have changed. So early on, teachers were in that notion of remove your mask while you're teaching, to then remove your mask only if you need to. And now it's try to keep your mask on as much as possible. It does, again, as you said, Ash, make it difficult in those younger years, but teachers are following those protocols as best as possible.
I think one thing that a lot of parents are observing during COVID, that they're learning a lot about just what teachers have always done, which is they're really great at adapting to that classroom environment and coping,
yes,
rather than panicking. And I think it's the parents panic a lot more than the teachers do. It's been very impressive to watch. Speaking of a topic that I know parents are very concerned about, we're going to get onto masks. I'll come to you in a second, Monique, lots for you. But Asha, just let's take it through are masks really necessary for kids?
I think in this high caseload environment, yes, definitely. Something that we have seen in the high schools and now, I guess, with year 3 and above wearing masks, is that fewer children are being called close contact. So there's actually more school days that are being achieved in those age groups. So I think that's a big positive. But the science of it also matters, and I think that the science tells us that when you've got children in classrooms that are wearing masks, then the transmission of virus between children is less, and so the masks are protective from that occurring. So I do think it's both a practical situation to encourage and to enable more children to have a day at school, because every school day matters for each child's education, but it also has, I guess, that scientific backing to it. And the World Health Organization has recommended in actually 6 years and above in high caseload settings that mask use strategies to be considered.
Okay, well, Monique, I know that's all great, but parents really worry about what that's doing for the social development, for the mental health of kids, and whether the benefits of wearing masks actually outweigh those potential detriments of wearing masks. What's your thought about that?
Look, I think we've got the benefit here that while this is just something new for us, we have examples from around the world, from the UK, from the US, where they've been wearing masks in schools for a long time. So we have actual solid data that we can look at to see whether it's having an ill effect or not. And largely, across the board, children aren't having problems with their mental health or with their learning and things for the time that they're wearing their mask in the classroom. So I don't think parents need to be concerned about that. That's not to say that there's not individual differences. There's children who are neurodiverse, who might have sensory issues, children who have hearing loss, who might really rely on being able to see the words being spoken. We can understand that for those children it's particularly challenging, and then part of that is that for the parents it's really hard to enforce as well. But largely it appears that, I have a son in year 3, and when I first heard the news about the mask, I immediately thought, oh, is that really necessary? And then I watched him go on to be absolutely fine with it, to not even really mention the mask wearing, and that his peers were pretty much the same. And I think it's a really important lesson for parents, one, to make sure that we don't just jump ahead before something's happened and be too concerned. Let's wait and see how it goes, and let's see if it is a problem first. And the second thing is that we can't, as parents, protect our children from every annoying or negative thing in their lives. And this is a really good example of how, well, some things are annoying, and when we're going through a work day with a mask on, we can't wait to take it off at the end of the day as well. So that's okay, but we can teach our kids a little bit of resilience and teach them that sometimes we do these things because we're protecting others, and we go through this hardship for the sake of the others around us. So that's a really nice thing as parents to I guess, flip the script on that and turn it around.
And if the child is really arcing up, they're very resistant to it, any other things that parents can do to try and help them get to wearing
Would a
masks?
marshmallow at the end of the day help if they do it? Sometimes kids are motivated by very, very small things, a Pokemon card. I'm not averse to any kind of reward system if that's what it takes. And parents know their children the best. So I think you do know within reason the sorts of things that might be motivating for your child. Would it be a play date once things perhaps calm down? Would it be something fun, some outing, an ice cream, something that you can find to show children that sometimes we do go through this and there's a personal reward at the end. We always obviously err on the side of reward rather than any kind of punishment and being angry at a child for not wearing it. So I think we'll try and find something positive, some positive reinforcement as a reward if they are resistant. But again, I think most of them are really adapting well.
And I'm finding that a lot of the young kids are quite excited about being like the big kids.
Yeah.
But there's also, you can do things like decorating the masks and try and make it a bit more fun for them, I guess.
And it's important as parents as well to look for a mask that fits so that you can minimise the discomfort. I think that's a really big thing. If you can find, even if it's a fabric with a filter or something that you've got there that actually they feel more comfortable in, that might make them more inclined to wear it. So that's a good thing as well.
And Ashley, let me come to you about that. So is there a particular type of mask that a kid should wear? Like we all know that the N95s and the surgical masks, they're much better than the cloth masks.
I think that's a great point. A mask that's being worn and covering the nose and the mouth is the most important thing. So whether it's an N95, a surgical mask or a cloth mask, I think is less important than the fact that it's being worn and that's covering the nose and the mouth and the chin. So making sure that it's not below the nose. We see some adults doing that, not great modelled behaviour for our young kids. And to be honest, the surgical masks are being made in smaller sizes and have become more available in our shops in WA here. So I think that those are a great option. If they don't quite fit, then you can tie little knots in the elastic for your kids just to get the size a little bit better for them for the day. But fabric masks are also a great option because you can choose something that might be more appealing to the individual. So there's lots of ways of doing it, and I think that it's hard to say that one mask is absolutely the be all and end all, because most of our data on that actually comes from healthcare settings and hospitals, and so we don't really have great data for this community setting where everyone's wearing a mask. So we know that wearing a mask matters. Giving some choice around having to do this is actually another strategy to help kids adjust to it.
Great, fantastic. All right, so Monique, let's move off masks and more to this question of how do we talk to our kids about COVID. We've lived in an essentially COVID-free world here in Western Australia for so long, and it's here now.
Yeah.
How do we talk to our kids about COVID now that it's here?
Yeah, there's been a real paradigm shift, I think, and I do see that some parents are struggling to make that shift themselves, but it's really important now that we understand that instead of the goal being the elimination and making sure that absolutely no one transmits this virus, that we understand that it is going around, it's no one's fault if they've unknowingly transmitted it, and that for children going to their classroom, we are doing everything we can to keep them safe, to teach them the positive things that they can do, as Asha mentioned, with the hand washing, the sneezing, wearing a mask for those children who are able to, even sort of younger than year 3. And we're doing all we can, but if we do get it, we know that it is a mild illness in children that we're seeing. There's nothing for them to be worried about. But I think one of the main things is, as parents, we stay very calm. And we talk to our children calmly about it, that they might be very frightened if they hear that one of their friends has tested positive, that we can just really calm them down and say, it's okay, it's all right. We know this, their mum's looking after them, they're in isolation, they're going to be okay. Things that we can do, to do a drawing, to do something nice for that child while they're in isolation is sort of all that we can do to sort of, I guess, empower them to be as safe as they can, but also understand that it is starting to spread in the schools.
And I think that's a really important message. So for so long we've really potentially in our own minds and in their minds talked about how bad this pandemic is, how bad this virus is, and with very good reason. But the reality is that for the vast majority of children it's going to be a very mild disease. And the other reality is that in the next few weeks to months, there's a very high chance that someone in each of our households is going to get COVID. And so we need to probably start that discussion now. If you haven't had it already in your household, start that discussion now about this is not the end of the world, that's actually usually pretty mild, and sometimes you'll have friends who've had a child with COVID and that they've been okay. And yes, we have hospitals in the very rare chance of you getting sick. So it's really a matter of getting them prepared for it. Neil, are teachers seeing a whole lot of anxiety amongst kids in the school about COVID?
We haven't had lots of feedback around anxious children, and I think the points that Monique made are right. Children are actually really quite resilient. They just get on with it a lot of the time. Initially, probably we all acknowledge they're a little uncomfortable, but beyond that, there hasn't been a great deal of angst with students, complaints, and in the primary setting more so. Students are going to, a generalisation I guess, but be a little more compliant than potentially a secondary student who's going to want to take it off and maybe, be defiant. Primary students are really quite okay. We tend to find parents get more concerned than the students do. And I could generalise around a range of things. To give analogies, parents get a lot more upset when children are in split classes than children do. Parents care a whole lot more when students are with their friends than students do. So they bounce really well.
They cope really well.
They do.
Jonathan, I think there's something really interesting to add into that, is that we've watched a pandemic for the last 2 years unfold globally without experiencing it. So we've been observing it, and we've seen, I guess, different waves of different of the variants that have occurred. The experience that we're now having in WA has, we've actually prepared pretty well for it in terms of our vaccination rates, and such that we are seeing the virus, transmit through our population, but not necessarily cause severe illness. And I think the case numbers being reported each day in terms of hospitalisation and people in intensive care units are surprisingly low compared to the rest of the world. So I think it's that reality check and readjusting our expectations and understanding of COVID. We've known the whole pandemic that kids haven't become very sick at all. I think that's been a common theme throughout the whole pandemic since it started in early 2020. But now when we're actually experiencing it, we're also experiencing the Omicron wave that is less, likely to cause severe disease, and particularly because our population is so highly vaccinated, and having passed 70% booster shots in WA now is something that I think contributes to that sense of reassurance, and something that we can talk to our kids about how well WA has prepared for this.
All right, well, you're on vaccines, so let's hit you with a few rapid-fire vaccine questions. how likely is it that a child will get sick even if they've had 2 vaccines, 2 doses?
So very, very, very few children, and I'm talking in the 1 to 2% of children, will need hospital level care as part of their COVID experience. So the vast majority will either have no symptoms or will have very mild symptoms, and most families will have a good experience already of having viral illnesses in their children and at home. A temperature, a cough, a runny nose, needing maybe some Panadol, and making sure that your child's drinking really well, because dehydration has been a high reason for kids needing to come to hospital. So paying attention to how much they're drinking as well as medications is quite important. You asked whether the vaccine is protective, really. Will 2 doses prevent more children from needing hospitalisation? Yes, it will. The vaccine actually protects even better from children needing hospital level care. And particularly, I guess, with Omicron, it's been much milder. Even children who've had 1 dose of the vaccine will be protected at this point, several weeks after receiving that first dose. And we know that we've just sort of passed the 8-week mark where children in that 5 to 11-year-old age group are now eligible to get their second dose. Some children in the high risk categories, so children who have medical illnesses, have already received their second dose earlier, but we're now seeing more families present for their second dose. So that will be protective, both of severe illness but also symptoms.
In fact, some recent data from New South Wales was that only 0.3% of kids with COVID ended up in hospital, and of that, half of them were there for something else. So it's actually pretty unlikely.
The majority are actually children who are in hospital for some other reason and happen to test positive. So they may have unfortunate things like appendicitis or a broken arm and need to be in hospital and test positive whilst they're there, but aren't actually needing to be in the hospital for that reason. So another piece of reassurance for families.
What about boosters? Will kids need boosters at some point?
I don't know, and I think that it will depend on the age groups a lot. So in some of the vaccine trials that they're doing for the under 5s, there may actually be a 3-dose schedule rather than a 2-dose schedule. So that's why I'm saying I don't know exactly. For the 5 to 11-year-olds, the vaccine response by separating out the doses by 8 weeks has actually been shown overseas anyway to have a much stronger antibody response. And for that reason, we may not necessarily need a booster dose. I think though with COVID, there are variants that change all the time. And so a booster dose might be considered if there's a new variant that we understand a 3rd dose would be better to protect from that.
Fabulous. What about so you've talked about how COVID is a pretty mild disease in most kids. So let's get down to, say, the 5-year-olds. What's the sort of cost-benefit equation when it comes to, is it better to vaccinate a 5-year-old with a potential risk for some side effects versus what's the benefit of actually protecting them from what is you've described as a relatively mild disease?
It's a great question, and for parents of 5-year-olds, something that they're grappling with at the moment. And we know that the vaccines do protect from serious illness. And whilst we say it's a mild disease in most 5-year-olds, there will be some that do get more sick. We also know that the vaccines in adolescents, it's been shown already. We expect to find this data in 5 to 11-year-olds as well, but it just hasn't been reported as yet. Protects them from the post-COVID illness that we call PIMS-TS. So it's an inflammatory condition that does lead to children needing to be in hospital. It's quite rare, 1 in about 2,000 children, but it is something that the vaccines are protective for. And the third thing is that we know that in this age group, vaccine side effects are being reported in about 1 in 4 children, but the majority of those vaccine side effects have been a sore arm, a fever, or feeling a little bit tired for a day or two. So very mild relative to some of the vaccine side effects that have been reported with the COVID vaccine in adults and even adolescents. We haven't seen any signal for the heart condition called myocarditis or pericarditis in this age group. And yet COVID can actually also cause pericarditis or myocarditis. So the vaccine seems to be protective from COVID causing that in your child, and unlikely in the 5-year-olds to have that side effect, which has been the most commonly concerning thing that's been reported in children and young people, not in 5-year-olds.
Cool. Lots of
facts
there. Neil, I'm interested in what schools are doing about infection control. In particular, some schools seem to be doing different things to other schools. with regard to infection control. Why?
Oh, this is a difficult question. It's a good question, a difficult answer, because it a lot of time boils down to context of the school, and the situation. So schools are going to do the standard things: hand washing, sanitizer available, masks on, trying to social distance wherever they can. But we've got scenarios where large schools, large primary schools, who have been asked to cohort their students, separate for assemblies, only have a year 3 assembly, then a year 4. Some of those schools, the year 3s alone, are as big as some of our small schools. So then small schools are saying, well, can I have a whole school assembly? Because the numbers are the same. So in each context, school leaders are taking that information, making the best decisions. I've had situations where members have called regional school, we are having a hockey carnival, should we go ahead? And I say, well, it's not my decision to tell you. It's not, in fact, the department's decision to tell you. You need all the information to make the most informed decision. How many schools are coming? Do you know if there's been any cases in those schools? Are there sharing facilities of toilets and change rooms? Are kids coming from the bus? So all those things you take into account and make a decision as to what's the best decision around that sports carnival. It might be that you have it with a small number of schools, it might be that you cancel it altogether, it might be that you postpone it. So they're the sorts of decisions that have been made. A common one is swimming. Lots of primary schools are linked to secondary schools who have outdoor pools and are in walking distance. So swimming lessons continue because the swimming lessons is outdoors, they're walking to the pool, whereas a school down the road or in the next suburb might actually all get on a bus, go to the local leisure centre, shared change rooms, on the bus, indoor pool, and so they say no. So there's some standard things that are all the same. There's some contextual things that impact how we do things.
And that's a pretty standard public health approach. It's kind of evaluating the risk and then
Yes.
making a decision based on the risk. So you talked a bit about, for example, cancelling some carnivals. What about, is there a tipping point of COVID case numbers at which a school would have to close?
I'm saying no because of the new rules around very high caseload. The new rules around very high caseload do indicate that should a close contact be identified, the school will actually identify which students are close contacts. When they're wearing masks, it's much easier because they should be wearing masks and not be identified as a close contact. And then they'll just advise parents to go home, get the RAT test. If they're negative and asymptomatic, they should return to school. So what schools ideally want to do is keep schools open, keep students learning, and just add those extra precautions. So we don't see a scenario where everyone in that school is either a close contact or positive at that time or symptomatic. That would be the very rare case where an entire school may close.
And I think this is a really important philosophy and one that I certainly support that the Education Department has been taking, which is the priority here is to keep kids in face-to-face learning.
Yes.
Because we know that face-to-face learning is the best. We also know that online learning, it's not as good, but also it's inequitable. Not every family has access to good internet. And we know that for many families, that's incredibly disruptive to their lives as well. So the priority being to keep kids at school for face-to-face, I think it makes really good sense.
Correct.
So you mentioned RAT testing before.
Yes.
What do you think the role should be of RAT testing, whether it's for staff or for students in schools?
I think it should be a one around if there is a concern or if there are symptoms to get one. Staff don't have, I guess, necessarily a choice around if you've been deemed to be a close contact. There is a requirement that that staff member will do a RAT test every day before coming to work, inform their school leader as to whether they are positive or negative before coming to work. So that is in place for school staff who are already deemed to be a close contact. Students, it is around that close contact, symptomatic RAT test. We don't feel there's a need at this stage to introduce regular RAT testing for children if they're asymptomatic and they're not close contacts.
So Asha, that's obviously not what's happening over in the East Coast. So tell us what is happening and what's the evidence that regular twice weekly RAT testing, whether for students or for teachers, actually makes good sense?
So that's a great question. We know as schools got started this year that New South Wales and Victoria both announced a twice weekly RAT testing program, and they implemented it for the first 4 weeks and then continued on for another couple of weeks. But I understand that in both states they are starting to pull back on that. Now, the benefits, I guess, of having an approach like that is that you find a few cases earlier than you might otherwise have found them, and so by staying home can reduce transmission in the classroom. It can also be, I guess, a reassurance to everyone that there is something that you can be doing to sort of contribute to reducing the risk of getting COVID at school or passing it on to someone if you didn't know that you had it. They have done a lot of studies overseas, and in those overseas studies haven't definitively proven that twice weekly rat testing keeps more children at school and keeps schools open more effectively, but it has, I guess, got some merit to it because it gives that level of reassurance. I suspect that we're going to see that phased out of the Australian education system, but we are involved in some research in South Australia looking to evaluate that and to understand it better, and colleagues in New South Wales and Victoria are also working on that, given that we've implemented these processes, really looking to understand what can we learn from them, have they been beneficial, or have they been something that we've done over and above that we might not do next time.
Excellent. And Monique, before we go to some of the live questions, we talked a bit about some of the online learning, the learning from home, and we know that that's working from home can be a challenge, let alone learning from home. Are there strategies that we can recommend to both measure and as well as maintain good mental health whilst learning from home?
Yeah, well, you know, ideally schools will remain open, and I think both of you have been advocates right from the very beginning of this pandemic for that. Schools are really essential structures in our society, as we've certainly learned. And what we've been able to see from the global data, and even in Australia, looking at Victoria where they've had more lockdowns and the two really long lockdowns, mental health of students who are kept home and who are online learning is poorer than the states where they didn't have those lockdowns and the school closures. The online learning works for some, but as you've mentioned, it's unequitable. So it's the students who are already socially disadvantaged. We're seeing differences in our Indigenous children. There's only just between 10 and 15% of children don't even have internet at home. Around about 20 in Australia, 20% of students don't have their quiet place to work. So when we think about how to set up our children for online learning, we've also got to recognise that for some, it's going to mean that there's not a lot of learning going on, and that's really not good enough. Not good enough as a society for us to accept that, I think. But for parents who are struggling with that at the moment, to have a quiet space that they can work, that the students can work, to make sure as much as possible that you minimise distractions in the home, to have regular breaks, encourage regular breaks, healthy eating. Always with parenting, you come back to the sort of really essential pillars of routine, predictability, stability. You have good sleep, you have a healthy diet, you keep things calm, you keep things as predictable in the routine as they can. They have the same breakfast, they try and keep as many things that can remain stable and normal as possible. You bring that in, so when the rest of the world is very unpredictable, we've got a way of at least trying to create a bit of a bubble around our kids to say, we'll keep as much of this as normal as possible, we'll keep calm going through this.
All right, look, we're going to get on to some of your live questions, and thank you for uploading them. Like I say, you can just pop on to the chat and put some more up there, but let's work through these. Asha, back to masks. Once mask wearing is stopped for primary school age kids, do you anticipate the cases are going to rise quickly?
Oh, that's a great question. It will, I guess, depend on what the level of numbers are at the time when that decision is made. So if they're high, then I would expect that it would continue to stay high. I think we've seen in New South Wales more recently with something that's relatively new called the BA2 variant. So it's a variant of Omicron. Maybe we can call it the cousin of Omicron or something like that. We've seen case numbers start to rise again, and in school settings as well as everywhere else in society, we are seeing some transmission happen. We actually know that about 80% of cases here in WA are the BA2 variant. So it's a more transmissible one. We're probably going to keep wearing masks for a while. When we take them off, will we see more transmission? Well, I think it will depend very much on our vaccination rates, as well as just how many people have been infected as we pass through this big wave that we're in at the moment.
Yeah, that's great comments. This one first for you, Monique, and this is about can my child get an exemption from wearing a mask if they're really struggling with anxiety with the mask?
I think you need to talk to both probably the family doctor, if there's any psychologists involved in your life, and the school for those sorts of questions. There are absolutely children who have sensory issues who will really struggle, and I think everyone will come to a really understanding solution on that for that child.
And Neil, what guidance are teachers getting about that when a child really is not coping with the mask? How does that get managed in the school?
Almost the exact same way. Having a conversation with the parent or the carer, trying to discuss what the main concerns are, looking at any alternatives, any that can be put into place, such as temporary wearing and time in the mask, time out of the mask. Schools will do whatever they can to work with parents to get to a point where an amicable solution is found, a common sense solution.
And I've heard of some teachers who just really say, look, let's take a 2 or 3 minute break, go outside, take the mask off and then back in again, and that often can be a bit of a circuit breaker. Asher, is the paediatric dose of the COVID vaccine enough to protect an almost 12-year-old child? Now, this is a really interesting one. And also, what about the fact that there can be some 12-year-old kids and some 12-year-old kids? What about size difference?
Another great question. I think the important thing that was shown in the preliminary vaccine trials that were done in the US and other countries of the world was that, and here I'm talking about the Pfizer vaccine and the dose for the Pfizer vaccine, it's a third of the adult dose. And they still showed the same level of antibody responses for 16 to 25-year-olds. So you can, I guess, rest assured that the vaccine dose that's being given for 5 to 11-year-olds is able to achieve that same level of really solid antibody response to the vaccine. We know that kids are, on the whole, similar weights at different ages, but we have a great variety in the height of kids and the size of children, and the vaccine has been tried based on age, and so we've continued to recommend it based on age. It's not being done based on weight, and so it's the age that your child is when they're due to receive the vaccine that is the dose that they'll receive.
Yeah, and I think that's a really important point, which is that we've got to base it on something. You've got to draw a line somewhere, but also that it's not as though it's the same thing as taking a medication, where it really might very much relate to your weight or your size. It's actually stimulating the immune system, and you don't actually need that much to stimulate your immune system. Neil, this one's for you. Schools are segmenting age groups to try and keep close contacts down, but how realistic is that when most have siblings in the same school? How's that going with the segregation?
Again, it's contextual to each school, and schools do get those same things put to them by parents. If students are segregating and then walking home with their siblings, the very same things are put to schools. So again, it boils down to trying to do as much as we can to minimise the risk and minimise the contact. We know that children are going to potentially segregate in school for a sports event or for an assembly. They may very well get on a bus, and in regional areas especially, get on a bus and all go home together, but the time that they have spent apart might in fact make the difference between potentially coming to close contact with someone or not. So it is about minimising risk as opposed to eradicating all risk.
And I think the other thing that I've noticed is, and this is probably, if you're from the government, don't listen. But I've seen some schools be a little bit creative with some of the things that, for example, when there are gatherings that have more than 1 or 2 year groups in them, whether they're for sports or for music, but they're small ensembles, they might be a little bit lax about saying, look, it makes sense for this group, even if there are 3 different age groups in it or year groups in it, to practice together or to play together. And I think that's something that we're seeing again. That's the creativity of schools, that where they're making sensible decisions, they're still very balancing the risk against the benefits. So.
Absolutely. And another thing that schools have done in that creative space is play around with the creativity and the innovation. So whilst on one hand we could say schools are segregating classes for sport or assemblies, we also now have scenarios where schools are zooming in their assemblies and student leaders are running it from the principal's office on Zoom while children are watching it on the screen. So just creative ways of keeping kids engaged and doing it differently.
All right, another one for you, Neil. Do schools have plans in place to make sure things like Naplan happen this year?
Ultimately, that is going to be decided at a government level, be that federal or state. What we do know is that when Naplan is done, much like COVID, schools really try not to overemphasise it and just make it an everyday part of school. So should the assessments go ahead, the next concern becomes, well, what happens with the data and what happens with my child's results? And there was a pandemic at the time. So the department takes just measures that when that data is published, they'll embargo part of it. They'll have caveats around it that, 2022 was a year when schools actually didn't have full cohorts of students. They might actually minimise some of the comparative data. So here's some of the data our school had, but we're not necessarily going to compare that with the schools in the local area. We don't know how many students were there at the time sitting that assessment. So it really is managing the assessment, but then managing how we use the data later.
Okay. This is one I can do. This is about the question around the percentage of kids who were hospitalised. Was that children who were unvaccinated or vaccinated? In fact, the data that I was citing, which was the 0.3% of children with COVID who ended up in hospital, that was from New South Wales. That was at the start of February, before most of the children actually had any vaccines. So it's a largely unvaccinated childhood population. 0.3% with COVID ended up in hospital, and as I said, half of those were not there because of their COVID. Hopefully, those proportions will even drop further as more and more of our kids get vaccinated. Back to you, Neil. The cleaning protocols. What are the cleaning protocols for schools when there is a positive case? And are there COVID specialist cleaners that are contracted? And if so, I want to buy shares.
There's extra funding has been provided to all schools, and this was dating back to 2020, and then it has continued, and that extra funding has allowed schools to bring cleaners in during the day. Those cleaners are routinely going around to classrooms, high contact areas, so be that desks, light switches, computer screens, and then when students are returning to class, obviously they're moving outside, in many instances doing playground equipment, and so maintaining the environments that way. In terms of should a school have a case, there's no team that swings into action and does a deep thorough clean off that school, as we did see early on. When back in 2020 there were instances where schools did close, either a classroom, an entire school, and then early this year when I think it was Winterfold was the first school, second day of term, and that school closed for 14 days. But once we've moved into very high caseload, we've just ensured that we're maintaining the high contact cleaning throughout the day and after school hours.
Okay, great. Monique, good question here. How can parents and teachers make sure they're not passing on stress or fear about COVID to their kids?
Yeah. It's something that we all need to be aware of, and as we've mentioned, it's something we feared for 2 years, and we've got to live a relatively normal life in those 2 years. It's natural to feel like, well, there's a bit of hesitation now that might be coming to an end. But I think it's very important to check in with your own feelings as a parent and understand how you're feeling. I think we see a lot of things heightened amongst parents during these times, and perhaps those who are naturally more cautious and naturally more anxious might really be sort of finding that things are getting a bit more overwhelming. For our children, they will look at what we're modelling to them. So again, to keep calm, there's some really, really good resources. There's been a lot more funding that's gone towards mental health, particularly for parents and carers. And Think Mental Health, wa.gov.au has a really, really extensive list, not just for parents, but for all adults, children, and various other sort of groups that you can see the links and easy access, not only to contact numbers of how do you get help in person, but also for the online help, which has had a lot more funding in the last 2 years. And that's fantastic news for people who are rural, remote communities who haven't had the access to mental health services in a really meaningful way before. So there is a lot of help out there, and if you're feeling like you're a little bit overwhelmed, there's absolutely no stigma in seeking help at the moment. We're all struggling and we're all making our way through.
And your comment about the fact that kids will soak up what's happening with their parents in terms of their mood, their anxiety is really important. And I know that during this pandemic we've had a habit of sort of tuning in constantly to the news feed, of talking about it, of talking about the anxiety, and I think that it's really important for families to consciously tune out from that at
Yes.
quite long periods, because kids do absorb the anxiety of their parents, don't they?
They do. I think it kind of hangs in the air a little bit within a household. And that's not to say that parents aren't going through some really real struggles. Parents who've had their income, have lost jobs, income reduced, all these sorts of things are actual real genuine stresses. But unfortunately, our children can't do anything about those. So it's keeping things a little bit separated between what you're dealing with as an adult level and what you can sort of show to your family. And again, that's not easy, but we need to seek help and make sure that we're doing all we can to be able to keep our children protected from some of those adult stresses in our lives at the moment.
Thanks for that. Asha, you've covered this a bit already, but I wouldn't mind reiterating it, because I think everyone's talking about the new, it's not really a new variant, is it? It's a new relative of Omicron.
Yep.
We've heard it's everywhere already. Is it any more of an issue for our kids than the previous version?
Great question. So I think it's commonly called BA2 as the, I guess, Omicron variant or cousin of the Omicron variant. And it seems to be maybe slightly more transmissible even than the BA1 Omicron variant, but no, I guess, worse in terms of outcomes and illnesses for children than we were seeing across the entire pandemic. So I think from a family perspective, and here we're talking about children, we're not going to see worse outcomes from it. On the whole, I don't think that we've seen in any of the countries in the world where they've already seen a bit of an increase in the BA2 variant, increase in hospitalisation. So I think the reassuring thing for children and for families is that even for elderly grandparents or adults who are around you that may be more vulnerable, if they've been vaccinated, then that will also be quite protective of this variant.
And I think it's also given us a bit of a wake-up call that we're all kind of seeing the light at the end of the tunnel, and hopefully that's going to happen, but this virus just keeps doing stuff that we don't like, so who knows what's next. Okay, Neil, a couple of practical questions around schools. What are schools doing in terms of contact tracing, and in particular, how do they work out which kids play with each other in the playground?
Schools are doing all sorts of things in this space, sometimes well above and beyond what they should be, and again that comes down to that wanting to be overcautious and overprotective in uncertain times. But everything schools are doing ultimately does flow down through the Chief Health Officer. So the important message here is that schools aren't just making things up and walking to a class and say, we've got a positive case here, everyone has to go home. So it boils down to from year 3 and up, we know students are wearing masks. If the masks are worn appropriately and teachers are regularly, and teachers are also wearing them, as I explained before, not off for 15 minutes, close contact with a child, not off for more than 2 hours in an environment, then ideally no one in that classroom should be identified as a close contact. That's a very easy decision for a school principal to make in conjunction with the classroom teacher. Were all masks on? Was yours on? There's no close contacts. When it gets to year 2, year 1, where there aren't students wearing masks, it then becomes a matter of who was close to who was working with who, and in most cases that's where we've in fact sent entire classes home. But with the new heavy caseload, it could be a case of going home, getting a RAT test, coming back the following day. So there are some quick strategies that schools are using. Playground becomes quite difficult. And that's where I think there has been a little bit of pushback and angst around how have you identified my child as a close contact, and really that boils down to talking to children as best we can. Kindy students and pre-primary students are very rarely going to remember who they played with and was it for more than 15 minutes. So again, schools are going to err on the side of caution. Just say we believe your children were playing together at recess time. A child has tested positive, which might mean your child is a close contact. So there's that conversation that takes place around it might make sense to do a RAT test, see if they're asymptomatic and negative, and return. But all of that information does certainly come through Chief Health Officer, through the Department of Education, through the school principals.
Okay. This one's a bit of a crystal ball. How disruptive do you expect this school year will be for our kids? Particularly there will be lots of events that are cancelled even if schools stay open.
Correct. That's the easy answer. Yes, it will. We've been making that message very clear so that to prepare people for the reality that school will be disrupted. Learning won't be the same. We know that whilst we could provide children with learning at home, it's not the same to having a teacher in your classroom learning with your peers. In terms of events, you know, it is a crystal ball as to when the rules change, when case loading changes, square metre rules. So schools are planning for lots of these events and just having a plan B and a plan C. Much like the assembly scenario. Schools plan for assemblies but then can switch to doing an online assembly. Schools might plan for a sporting event and then break it up over 3 days. We want to try and keep schools as normal as possible. So most schools now are planning a plan B, a plan C for whatever that event might look like.
Okay, thank you. Asha, questions around the immunity that you get after infection. So if a child tests positive to COVID, does it give them any future protection against the virus? For example, will my child who's too young to vaccinate have some immunity after infection? And I guess the second question is, what about if they have been vaccinated and they still get COVID? What does that do to their immunity?
Those are great questions. So for someone who's had COVID, they will mount an antibody response to it. We find that in the tests that have been done, it's relatively short-lived. And so when I say relatively short-lived, a couple of months is probably what we think that antibody response will last to it. And that's been looked at in lots of different populations around the world. And it's fairly consistent with the whole family of coronaviruses, where we have seen for years that the common cold will infect you every year or a couple of times in a year. So not really that big of a surprise. We know that the vaccine, I guess, helps to mount a broader response to the COVID virus. And so whilst we've got lots of different variants that have progressed since we've first learnt about COVID, we know that the vaccine gives, I guess, a slightly broader immune response. And so those children who've been vaccinated and then experience COVID are likely to have a better antibody response based on that. Will it protect them from the next variant? It probably will, but it's also hard for me to give a really solid answer to that because, like we talked about a crystal ball, we don't actually know what that next variant will look like and how relevant this particular vaccine will be to that variant.
And we have seen that getting infected with the Delta strain didn't actually provide much protection against Omicron, whereas it looks like Omicron infection probably provides better protection against Delta. So it's not predictable, I guess.
Exactly.
So still with you, this is how do you look after your child at home who has COVID? What are the things you should be doing?
That is such a great question and a really practical one, I think, for parents and for myself as well with a Year 4 and a Year 6 student. So I have children in this age group, and being prepared for it and having things on hand. And I think families have really gone about this pretty thoroughly already, but making sure that you have their favourite drinks, because like I said before, we've got to make sure that we keep fluids up. It doesn't really matter if your child eats when they're unwell.
So Coca-Cola's okay then, is it?
Oh, good question. Oh, so maybe a little, if Coca-Cola is your favourite drink and you really want to have it, then maybe a little bit of it's okay. But water is probably our preferred healthy drink, a little bit of juice, but making sure that they are able to drink is really important. Having Panadol and Nurofen on hand if they have some aches or a fever is really important. And for children who are, I guess, at a slightly higher risk of having a more severe aspect of COVID. And when I say more severe, they might have a higher temperature for longer, or they might actually be in that very small percent who do need hospital level care. There is COVID care at home. So there are systems you can opt into where you'll get, I guess, contacted by a GP if your child's in that particular group. And some of the things that would put children at that slightly higher risk, if they have a chronic medical condition, some developmental concerns, trisomy 21, which is also known as Down syndrome, some of the, I guess, respiratory complications. Obesity is also another reason that children might have a slightly higher risk of getting sick. And so those are the children that, if you regularly see a paediatrician or you regularly are a patient of a children's hospital or a hospital, then you might want to opt into that COVID care at home. And there are paediatricians even working at the Perth Children's Hospital who are providing that extra level of surveillance for those families.
Great. So this is, if you're wanting to know more about that, obviously just go onto the WA Health Department website, COVID Care at Home. As Asha said, it's not designed for everyone. It's designed for people who really need it, mainly people with risk factors, and yes, it's for people also who just don't have any supports and they need someone to help get them food, etc. But without a doubt, for most people, if your child is sick, then your GP is your best first port of call. But there are some who will benefit from COVID Care at Home. Back to you, Monique. We've talked a bit about anxiety, so I think we've made a few people anxious. What are the signs of anxiety I should look out for in a young child?
So we know that anxiety is part of all of our lives. We get frightened from time to time, and it's got a really adaptive kind of response to fear. But when we start to get concerned with anxiety, we look at about a 6-month sort of time frame. So what we might be seeing with the current COVID is perhaps an exacerbation of a naturally more cautious, anxious child. So over about 6 months, is the child's worry starting to take over? Are they worried about everything? And is that worry generalised to all aspects of their life? You can have specific phobias that a child might be particularly concerned with germs or cleaning or making sure their hands are washed. But generally we'll look at just anxiety across all areas of their life, that they're starting to worry about all sorts of things. Then we look at their sleep. Has their sleep changed? Are they sleeping less? Are they finding it hard to get to sleep, waking up in the night? Is their appetite changing at all? We look at what we call hypervigilance, which is a real inability to concentrate, looking all around, worried all the time. Are they having any physical symptoms? They're saying that they're finding it harder to breathe, if their heart's racing. And all of these things, again, are very easily available on the Kids Helpline website. So if you sort of didn't catch all that, there's lots of fact sheets about that. And that will tell you when to worry. So while all these things are pretty transient, they come and go through our children, if you start to see this in a prolonged period, that's when you might want to contact your GP, who can then refer you on to other services.
So if you're worried, that's your first port of call. Is go to
Yeah,
your
I
GP.
think it's really good for parents to educate themselves at the moment into those just basic mental health first aid, because what I've really learned, for me it's all second nature, but I've learned that there's not a huge amount of understanding about some of these mental health problems amongst people who've never had to face these things before. And so for parents, when they start to see these issues in their children, it might be the first time they've ever come across this, and it can be really scary to think that there's... One thing I would say is that mental health problems, there's such great evidence-based scientific treatments out there. So, and that's both from the non-medical in psychotherapy, but also in just really basic tools that children can learn, and also and particularly with anxiety and depression, there's also medical treatments available. But it's not something that you need to suffer from, and that your child needs to suffer from or be concerned about for their whole life. There's really, really good treatments available, and they're often really quick too.
Okay, thank you. Neil, a couple of questions for you. What happens if a child is home with COVID or is a household contact? Do they get schoolwork to take home?
That is again a contextual decision at the school. There will always be work.
Yep.
As I said before, the school might not provide the child going home with the same work that the class is doing, because quite often you can't predict exactly what that's going to be, and teachers are adapting to the children's needs as they're teaching. Quite often teachers will provide work online, and there's access to online work. Quite often they've made pre-packaged work packages for students, but I would come back to the point Monique made around, it really is about routine. So teachers don't necessarily want students at home waking up and doing the exact same school routine they would at home. It's just not sustainable. So they're really just trying to keep them in the habit of studying, doing a bit of reading, doing a bit of maths, maybe writing a little bit, having some free time. So they don't need a lot of work. And the thing we've been telling school leaders when they've been calling us around this is, if a student does need to isolate for 7 days, and we take a practical approach to this, unless they're tested positive on a weekend, really we need about 4 days worth of work, and not full 4 days. Because on day one, if it's a school day, there's all that testing taking place. There's all that, what do we do now? Who do we tell? Where were we? So day one's gone.
Yeah.
So then you've got a weekend in there somewhere. So you're really left with sort of 4 days to think about what's going to keep our child active and in a routine at home without making it school at home.
Thank you for that. Some good questions about air filtration and ventilation. People are worried we're going to be going into the colder months, and so right now we've got all the windows open and lots of air flowing, but what's going to happen in the colder months? Will that air filtration and ventilation in classes be reviewed or audited as the weather gets colder?
I can't give a definitive answer on that, because that again, even information to that level does ultimately come down from the Chief Health Officer through to the Department of Education, and then we make decisions accordingly. What I can tell you is that whenever there's been a extenuating circumstance in a school, the schools work with the Department of Education to make some common sense decisions. An example I can give you that might help set the scene is we've had classes where windows have had to be open or doors have had to be left open while filtration is happening, and there might be students with specific needs who have just found the ability to race out of a classroom, hide somewhere, and so in those instances we just need to put a safety plan in place, and maybe the best safety plan is not to leave that door open. Doesn't exactly answer the question about winter and warmth and so on, but I dare say we'll get some timely advice around what that looks like.
Great, thank you. A few quick ones for you, Asha. Is COVID, well, I don't know if this is a quick one, is COVID an autoimmune disease?
Oh, no, it's an infectious disease. Does it affect your autoimmune, risks? There's not a lot of evidence for that as yet. So I'd say it's not an autoimmune disease. It's an infection that you have an illness for lasting up to about 7 days, and then it passes.
What about some of these rare complications you talked about? Could they be autoimmune diseases?
So the rare complication that I was talking about, called PIMS-TS, is an inflammatory condition. It doesn't tend to have a lifelong phenotype, so once again it's fairly short-lived and can be turned off relatively quickly with the treatments that we have available. So still wouldn't classify that as an autoimmune disease, and all of the children who've had that get the treatments and then followed up for a couple of months, but then tend to resolve.
Okay. My children have fabric masks. Should these be washed every day?
Definitely.
That's easy. There you go. And what about COVID in kids? Have we learned anything about long COVID in kids from overseas experiences yet?
Another great question. We've had a lot about long COVID in adults, and we have seen on the whole that the sicker you are with the illness with COVID, the more likely there may be some lingering symptoms. We also have, been pondering more recently. We don't know that much about how long the symptoms last on the whole for other respiratory viruses, and there's always a window. We kind of, as paediatricians, know that a cough after a respiratory virus sometimes lasts up to 3 to 4 weeks. If it goes beyond that, we start to worry. And the vast majority of kids who've had COVID, all of their symptoms are completely resolved by 3 to 4 weeks, including that cough. And from all the studies that have been done overseas, a small percentage may have some lingering fatigue, some headaches, or feeling not quite right. And I think that's the study that needs ongoing research, because whether that's because of COVID itself or whether that's because of some of the other disruptions that are happening in life, as well as some of the anxiety that Monique's been talking about, could be contributory to that. And we don't know for sure whether it's actually the virus causing it. What I can say for parents to be really reassuring is that the medical services are available for children who have prolonged symptoms, and they would be seen by a specialist paediatrician and assessed for that. So don't need to be too worried about that at the moment, because the vast majority will resolve.
Okay. All right, now we're going to wrap things up now, but I'm going to ask each of you 2 questions. And the first one's a crystal ball question. So Monique, first one to you. What do you think Western Australia will look like in 12 months' time, and what will living with COVID be in 12 months' time?
Well, from a mental health point of view, I really hope that we start to value the mental health and learning and social interactions of our children, and make sure that we consider that when we're holding it up against the risk of COVID, because I think we've been okay at putting that aside a little bit, but as we're seeing with the places in Australia like New South Wales and Victoria that have had the much longer lockdowns, anxiety and depression are up about 40%. There's a lot of grief, loss, trauma that we're going to have to process. So to make sure we don't take the fun of the camps, the balls, all those sort of things. In the next year, I hope we get to a point where we learn that also, while we're balancing the risk of COVID, we need to really protect our kids' mental health at the same time.
Neil, what about 12 months' time? What's your view of what it's going to be like to live with COVID, for example, for schools?
For schools, I similarly would like to think that schools have moved into a phase of what worked and what can we learn from this. So lots more innovation, whether that be, and not necessarily going to all online learning, but how do we use those experiences and lessons from being online or from working in a different environment, having teachers teach classes, students that are directly in front of them, but also be able to teach students in a different class through those means. So how do we use the most of the innovation? How do we come out the other side knowing what we've learnt to actually enhance what education looks like?
Great answers. Asha?
So I think COVID has thrown us a few curveballs already, and I think we're going to see more variants emerge. So not to say that that's I don't want to be the pessimistic one in the group by any stretch, but I think the things that we've learnt, such as staying home when we have symptoms, really assessing for our respiratory virus symptoms, but also our mental health. I hope that we will continuously get better at doing that for our individual selves as well as for our children and our families, so that we are, I guess, able to make even better decisions about what is right to do today and how that might impact on others. So it's a phrase that I think we see a lot in WA is we're all in this together. And I'd like to see that in 12 months' time we've learnt to live with it and continuously embrace that consideration and compassion for everyone around us, that we are taking care of others as well as taking care of ourselves.
Nice optimistic view. So let me stick with you. Last question, which is, what's the one message you would like parents to take home from tonight?
I think the one message is that COVID is relatively a mild illness. Our job as parents is to really reassure our kids, and schools are the best possible place for them to be. So really supporting our teachers, our school staff and our principals to continue to do the great job that they're doing in keeping our kids at school, making these tricky decisions and navigating them, but really supporting them to continue to do that, because we know that every school day matters and the best place is face-to-face learning.
Neil?
Certainly have faith and trust in what the schools are doing. These decisions are generally coming from health to school, then to parents, not being made on the fly, and schools really are there to keep kids in school as much as possible, to keep kids happy, to normalise school, and parents need to work, I guess, in conjunction with school to make that happen.
And Monique?
I would say to parents to really keep the lines of communication very open with their children, to, as much as you can, ask open-ended questions, to really know exactly where they're at with their worries, their fears, all the things that they've lost or the things that they might be expecting or concerned about for the future. To, as much as you can, keep that communication open so that you and your child are on the same page.
Fabulous. Well, look, that's, I'm afraid, all we've got time for tonight. Thank you all for your wonderful questions. We're sorry if there are some that you asked that we didn't get a chance to cover, but we covered a lot of ground tonight. This forum will be made available in full in the coming days, so keep an eye on the Telethon Kids Institute website or get in touch with your school. I want to say a huge thank you to Neil, to Asha and to Monique. Fabulous for getting through so much in such a balanced way. Can I also say a big thank you to the schools who made this possible. That's West Leaderville, Mount Hawthorn, Wembley, Lake Munga, North Perth and Subiaco Primary Schools, as well as Bob Hawke Secondary College. So that's it from us. Stay safe everyone, and good night.